Good afternoon and welcome to the COVID-19 update on Channels Television. I'm Millicent Wonwaka. First, some of the highlights. Today, Nigeria records more COVID-19 cases as government renews efforts towards flattening the curve. Lagos State government considers a full reopening of the economy. Some encouraging news from the United Kingdom as schools reopen for classes. Meantime, it's raining cats and dogs here. I wonder what it's like where you are. We'll begin with the government across all levels. Gatekeepers of the health sector and frontline health workers are rolling up their sleeves to flatten the curve of the COVID-19 pandemic. The challenge now is the best method to adopt. Currently, some state governments are considering reopening of their state's economy, but there are anxieties over this move as many anticipate that it might just lead to more increases in the COVID-19 across the country. The World Health Organization, based on a prediction modeling, looked at 47 countries in the African region with a total population of 1 billion, given statistics of nearly 200,000 people who could die in Africa if the COVID-19 containment measures are not prioritized. As we try to get our lives back to normal, how can Nigeria ensure that the guidelines outlined in the safety protocols are religiously followed? On our theme this afternoon, we consider some of the challenges in the fight against COVID-19. Meanwhile, Nigeria recorded 307 new cases of COVID-19 in 14 states of the Federation and the Federal Capital Territory, according to latest figures released by the Nigeria Center for Disease Control, NCDC. This brings the total number of confirmed COVID-19 cases in the country to 10,162, with 3,007 patients discharged and 287 deaths recorded. Of the 307 new cases, Lagos has 188, the FCT 44, Ogun 19, Kaduna 14, Oyo 12, Bayelsa 9, Gombe 5, Kano and Delta 3 cases each, Imo, Rivers, Niger and Bauchi states 2 each, 1 each in Plateau and Kwara states. A breakdown of the figures by region show Lagos in the southwest has the highest number of cases, with 4,943, still followed by Kano in the northwest, 954 cases. The FCT in the north-central region maintains the third highest tally in the country with 660 cases. In the northeast, Borno has the highest figure of 271, while Edo in the south-south with 284, and Ebonyi there in the southeast with 40 cases. Now, just as you saw, Kano Strait remains one of the epicenters of coronavirus in the country, besides Lagos, the highest number of cases in the northwest. Current figures show that the state recorded an additional 3 cases after conducting a total of 4,735 tests. Total confirmed cases we earlier brought to you at 954, but the number of active cases stands at 669. With a total 240 discharged and the death toll at 45. The Kano State government believes that efforts by the state in flattening the curve is yielding results. And Lagos is taking steps towards full reopening of the economy. This is coming from the governor of Lagos State, Babajide Sanwo-Olu, who spoke at the weekend. He said although the reopening would not be in a hurry, the government is concerned about making the economy run again. He says the state cannot continue to keep people's businesses on a lockdown, but explains that it will be done in phases. According to the governor, we are at a level where we are reviewing the other arms of the economy. In the coming days, we will be starting what we call register to open, which means all players in the restaurant business, event centers, entertainment, malls and cinemas will go through a form of re-registration and space management. He further explains, for us, it is not to say they should reopen fully tomorrow or anytime. There has to be a process guiding the reopening. We will be mandating LASEPA and Safety Commission to begin the enumeration process, and the agencies will be communicating with all relevant businesses and houses in the days ahead. I must, however, caution that this should not be misinterpreted as a license for full opening. It is certainly not. the state's economy is not ready for that now. The protesters you see are some youth from Kababunu local government area of Kogi State, and they are on the street to protest what they call a scam in the declaration of the chief imam of the local government, Ahmed Ejibunu, coronavirus positive. Recall the last week during the Presidential Task Force briefing, the NCDC Director General, Dr. Hikwazu, confirmed that the chief imam tested positive to COVID-19, that there was no confusion about the tests carried out. Responding to that, the Speaker of the State House of Assembly, Right Honorable Matthew Kolawole, insists that Kogi State is COVID-19 free.
We have Ministry of Health. We have Commissioner for Health. These people, we have squadron team. Were they contacted that they are taking anybody for test? No. If somebody is sick, he's being referred to an hospital for any reason, those concerned, the authority concerned, should be aware that, okay, you are taking those person away, you want to go and run tests for him. And if somebody is sick, you cannot just say because somebody has one ailment and then the next thing you do, you say he tested positive of COVID-19. I don't believe the man has COVID-19. And sincerely speaking, when somebody says because he has flu, yes, flu is a normal symptom of anybody. It's a normal symptom of malaria. I used to have flu, and when I have flu, I treat it, it goes away. So why would they say he has COVID-19? As at this moment, I am telling you, sincerely speaking, no COVID-19 anywhere in Kogi State, and not even in Kaba in particular.
Well, during the visit of the Presidential Task Force team on COVID-19 yesterday to the president at the villa, they gave him an update on the situation and how the spread of the virus is being contained across the country. Some of the major concerns raised by the team include the refusal to test for COVID-19 in some states and the reopening of worship centers.
Once more, the chairman of the Presidential Task Force on COVID-19 leads his team to the presidential villa in what has become a bi-weekly ritual. The aim is to share observations, discuss challenges, and fashion the way forward as the country enters the fourth phase of the ease on lockdown. The opening of worship centers in some states, the refusal to test in some others, are some of the issues the task force discussed with President Muhammadu Buhari.
Issues of places of worship, the issues of schools, the issues of certain businesses that were not open hitherto, part of the packages that we have looked at, and we've made the appropriate recommendations. But you know that Mr. President is the only one that can take decisions in respect of that. Certain steps will be taken. We're doing everything to ensure that the entire nation is on the same page with one response. And it is very, very important we realize that no state can be an island unto itself.
He says his team made some recommendations, but only the president has the final say. It is clear, though, what the next phase will look like.
I can assure you about one thing, that the ownership of the next phase will be the responsibility of the states under national supervision and coordination, because we have gone into community transmission. And where are the communities? The communities are in the states. So the ownership of the next phase will be that of the states, the local government, the traditional institutions, the religious leaders at the different levels of our communities, because that is where the problem is.
Mr. Mustafa says President Buhari has continued his appeal to citizens to take responsibility, saying while progress has been made, there is more work to be done. As the fourth phase beckons, the task force says it is guided by the need to strike a balance between lives and livelihoods. It is unclear whether the next set of guidelines will be communicated via a presidential broadcast or the task force briefing.
So what are the ways that we can contain the spread, saying that every day we keep getting more and more numbers of COVID-19 across the country? Joining us right now via Skype is Dr. Abdulaziz Bako. He's a PhD candidate, health policy management with the Indiana University. We'd like to thank you for joining us at this time.
Thank you very much for having me.
So, Dr. Bacco, it appears to be a situation in the United States, and also compared with the fears of a spike in COVID-19 cases. Tell us how, indeed, the government there is trying to perhaps settle things with the protests that have been going on across the country, and then, trying to indeed stop the further spread of COVID-19.
A lot of states have started, or I think most of the states have started reopening their states. A lot of worship places, businesses, and other places have been opened, and these are phased openings. They are very much dependent on how the infection is spreading, looking at how many people are infected every day, whether they are flattening the curve, which means that a decrease in the expected number of people that are going to be infected. So when you see that the number of people that are infected every day is decreasing, or the rate at which it increases is going down, then that gives you an indication for reopening the state. And they are doing a lot of random testing of people to understand sort of the prevalence of the disease. Indeed, these protests that are going on will definitely serve as a setback on the fight against COVID-19. But I believe that we will see the effect in the next few days, whether if there would be one.
Dr. Bacco, are you surprised with the figures we're getting? Just as at today, at least over 5,000 more people in Africa tested positive for the virus. And we're looking at the highest in the region, North Africa, followed by West Africa. And the latest numbers in Nigeria, a little over 10,000. Are you surprised with the figures that we're getting?
I'm not really surprised. I think the numbers, especially for Nigeria, they could have been much worse because we are, of course, we are having low testing. That could be the reason. But then looking at the number of cases that are coming on every day. You would expect as I mentioned in our previous interview, you could expect that the doubling time was about 6 days, and then now it's much more than about 10 days, which is showing that somehow we are, doing well. That's optimistic, but I think somehow, the numbers, if we look at them, they're not as bad as we might think.
So if we're planning to ramp up testing, since we've been told testing is king, to know what, the reality of the people infected with COVID-19, and then we're adopting the best method, most reliable, what's your take on the use of the rapid test kits, which, the Medical Laboratory Society have banned, and the government, the NCDC, says is unreliable?
Yes, so there's a lot of issues about the reliability of those rapid diagnostic tests, and most of them are antibody tests. They are to show you if a person was previously infected or he is currently infected. So you might not know the positive test with those kinds of antibody tests. They don't tell you whether a person is infected right now. It could be that the person has been infected and they have recovered. So I believe that, having those two in hand or using them side by side would be really useful. And it's much better than having one.
All right. So moving ahead, perhaps your final comments. What advice would you give to some of the states that are saying, okay, it's high time, let's start to reopen the economy, and this is side by side with the numbers some of these states are recording?
I believe that, states should start thinking about how to reopen, because, it's not a question of whether we should reopen or not. Especially we need to reopen, but we have to look at the numbers. We have to use science to guide us whether we should reopen or not. We should look at our exact, or try to randomly pick people and test them to see the true prevalence of the disease in our community and, continue the testing, contact tracing, and all the other stuff that the public health officials have been talking about that could be used to reduce the rate of infection.
All right, Dr. Bako, stay with us. We'll come back to you. We also have more states as they continue to ease restrictions of lockdown amidst the spike in coronavirus cases. Do join us again. Welcome back. And states continue to ease lockdown restriction in the wake of COVID-19 while mitigating the economic hardship caused by the pandemic. First, we begin with Ebonyi State, where the government received palliative worth millions of naira from Victim Support Fund COVID-19 Task Force team. The state governor, David Mahi, who received the items at the Akanu Ibiam International Conference Center, Abakaliki, through the deputy governor, commended the Victim Support Fund, assuring them of equity and justice in the distribution of items. In Ekiti State, the governor, Kaide Fahimi, has relaxed the lockdown, allowing free movement Monday to Friday while subjecting reopening of worship centers, schools to consultations. The governor also announced the relaxation of the lockdown imposed on the state, where Ekiti people will now enjoy free movement for their daily activities from Monday to Friday between 6 in the morning and 8 in the evening. Similarly, from Monday, public officers on grade level 8 and above are to resume for duties, while those on grade level 7 and below are to remain at home till further notice. Over in Akwa Ibom State, the government approved the reopening of churches in the state from Sunday, June the 7th. This is based on guidelines recommended by the Christian Association of Nigeria, CAN, backed by an undertaking to comply and signed by representatives of all the blocks. The state government is confident that CAN will do everything within its powers to ensure that all churches adhere strictly to the guidelines. And finally, in Nasarawa State, 3 doctors tested positive for COVID-19, leading to the temporary closure of the obstetrics and gynecology department of the Federal Medical Center in Kefi. All members of staff of the department who were primary contacts of the doctors have since been isolated. Now, one of the need of patients who are under severe conditions from COVID-19 infections is the ventilator. A lot of effort has been put in place by Nigerians to produce indigenous or local ventilators to suit our environment. And one of those on the forefront of this is the COVID-19 initiative. And we have joining us Professor Kessington Obagbon of Chemical Engineering, UNIBEN. He's the head of the COVID-19 initiative team, and he and his partners have made significant progress in the production of ventilators. He joins us now. Thank you, Professor, for joining us on the program. Tell us, Prof, what was the driving force in getting into ventilator production?
Thank you very much. It's my pleasure being on your channel's television. As you rightly said, the group is known as the COVID-19 initiative team. During the lockdown, we decided to come together as a group and put something because the ventilator was a very essential element in the treatment of the COVID-19. So we were able to get a design and we produced a prototype, which was fully tested using artificial lungs, because we have one of us who is a professor of anesthesiology, because they are the end users of the ventilators. So this ventilator has been tested. It can use both battery and it can use electric power. It can even be solar panel. We can also use solar energy. And the beauty of this ventilator is that it is very portable. It's very handy. You can move it from place to place. You don't need too much machinery to move it from one point to the other. So since we produce this ventilator, we have tested it to so many agencies, most especially the Standard Organization of Nigeria also came to watch the demonstration of this particular ventilator. And I'm very happy to tell you that they gave us a very good report that the ventilator itself has met a lot of international standards, ISO standards that is required for the ventilator. Because we have a medical man in the team, we're able to rely more essentially on his piece of advice, and we're able to upgrade the ventilator. As I speak right now, the ventilator, like I said, it can work in it has two modes. You have the children mode, which is the pediatric mode, and you have the adult mode, which means we can use it for both children and for adults. Because for the child mode, usually, the frequency for the child mode is about 20 cycles per minute, whereas for the adults, it's about 10 to 12 cycles per minute. These things have been tested, and I can tell you this ventilator is ready. It's ready to be used because we have actually been in focus with so many agencies. We have also been talking with the Federal Minister of Investment. Federal Minister of Agriculture has also come. We have also demonstrated this ventilator with them.
All right. All right. We'd like to appreciate your time on the program and hope that, we can see more of this clinically tested ventilators for use as, of course, we fight this pandemic. We appreciate your time. Professor Kessington Waiwan of Chemical Engineering, UNIBEN, head of the COVID-19 initiative team.
Thank you so much.
Now let's go over to Bauchi, where our correspondent Hajara Aliyu is taking a look at the progress made by the state in managing the COVID-19 cases. She brings us an update on the latest additional lab to the National Laboratory Network, and that's the Bauchi State Reference Molecular Laboratory.
Bauchi State now has the capacity for COVID-19 tests. This building behind me was constructed under 2 months, and it is the new reference laboratory in Bauchi State, owned by the state government in collaboration with the Northeast Development Commission and certified by the NCDC. The lab has been activated, and it is set for commissioning. It was supposed to be commissioned today, but we have been reliably informed that the event has been postponed to a later date for some reasons. We spoke to the team leader of the project, Professor Sani Malemi, and this is what he has to say.
This has been successfully completed. The team that came from NCDC has evaluated our laboratory in terms of the equipment which has been installed, which is the real-time PCR equipment capable of amplifying and detecting very, very, very extremely low levels of viruses, but in this instance, the COVID-19 virus. In addition, the NCDC has determined that we have the right staff mix, the right staff component to be able to execute this assignment. We also have enough spaces, and also the safety standard of the laboratory has reached the level which is expected of a laboratory of that class.
Personnel training is one area of concern, bearing in mind what happened in Kano.
We were very lucky and also very grateful to the NCDC. The staff that came for the activation spent a total of 5 days in Bauchi, which is unprecedented. I believe they were guided by the experience they had especially in Kano, unfortunately, where immediately after the activation, the laboratory had to be shut down because the safety measures were not properly implemented by the staff. They had a lot of contact with our own staff. They evaluated the capacities and the competencies of our own staff, and they were satisfied. And we are very happy that they spent so much time to put the staff through on what it means to run a laboratory of this magnitude, of this standard.
Before now, Bauchi State took samples to Jos and Abuja, but with this reference laboratory, it now has the capacity for 100 tests per day, and this will be scaled up with time. From Bauchi State, Hajara Aliyu for COVID-19 update.
And as some lockdown measures in England are eased, primary schools are welcoming back more pupils today. Children in reception years 1 and 6 are returning, many after 10 weeks absence through those schools, and some areas remain closed. Mass testing continues in Spain, in the region of Madrid, in a bid to isolate coronavirus cases and stem the spread. So far, more than 6.1 million coronavirus cases have been recorded, with over 2.6 million people recovering, and sadly, 372,303 others have died. From the NCDC, every new case is motivation to keep pushing, and each recovery is proof that we can get through this together. Take responsibility is the message. The website has all the information and statistics on cases across the state. Also from the World Health Organization, you can find the situation dashboard and indeed rolling updates on the pandemic. Our website, channeltv.com, has the latest news. All you need to do is log on. Access news in health, politics, sports from Africa, the rest of the world, all at your fingertips. That's the COVID-19 update. I'm back again at 6. Thank you for watching. I'm Millicent Walker.